I'd like to show you something that many people overlook, even though they've been doing it their entire lives. It's not a pill, not a supplement, not a device. It's your breathing. And in the next few minutes, I'm going to guide you through three simple breathing patterns that many people use to help their body relax and support healthier blood pressure responses, especially during moments of stress. We'll move slowly, and I'll count the timing with you so you can follow along right now if you'd like. Many people are surprised to learn how closely breathing is connected to the nervous system. When breathing becomes fast and shallow, the body interprets that as stress. Blood vessels tighten, heart rate increases, and pressure inside the vessels can rise. But when breathing becomes slow and steady, the body receives a very different message. The nervous system shifts into a calmer mode, blood vessels relax, and circulation becomes smoother. Research in this area has shown that slow breathing can support noticeable reductions in blood pressure within a short period of time for many people. Not because anything is being forced, but because the body is responding naturally to calmer signals. By the end of this video, you'll know three breathing techniques when each one can be useful and how to practice them safely as part of your daily routine. These are not meant to replace medical care. They are simple tools that many people use alongside their regular care to help their body stay calmer and more balanced. Let's begin with the first technique. This one focuses on a longer, slower exhale, which is especially helpful for calming the nervous system. You may hear it called the 4-7-8 breathing pattern. Here's how it works. You breathe in through your nose for 4 seconds, you gently hold for 7 seconds, and then you breathe out slowly through your mouth for 8 seconds. That longer exhale is important. It sends a strong signal to the body that it is safe to relax. Many people find this helpful when they feel tense, restless, or when their heart feels like it's beating a little faster than usual. Before we start, try to sit comfortably. You don't need perfect posture, just a position where your shoulders can relax. If it feels comfortable, place one hand on your belly. When you breathe in, you should feel your belly rise gently. This tells you that you are breathing deeply rather than shallowly. If you happen to have a blood pressure monitor nearby, you can check your numbers now and write them down. We'll talk later about checking again after breathing. Now let's begin. First, breathe out gently through your mouth, letting the air leave your lungs. Now close your mouth and breathe in through your nose. Inhale. 1, 2, 3, 4. Hold gently. 1, 2, 3, 4, 5, 6, 7. Now exhale slowly through your mouth. 1, 2, 3, 4, 5, 6, 7, 8. Many people notice that their shoulders feel softer, their breathing feels slower, and their heart rate feels steadier after just a few rounds. If you checked your pressure before, you may want to check again now. Some people notice small changes right away. For others, the benefit builds over repeated practice during the day. A simple routine is to practice this for about 2 minutes, 4 times a day. In the morning, sometime midday, in the late afternoon, and again before sleep. Over time, this trains the nervous system to stay calmer even when you are not actively doing the breathing. Now let's move to the second technique. This one is even simpler, and many people like it because it feels very natural. It's sometimes called resonant breathing. Here, you breathe in for 5 seconds and breathe out for 5 seconds without holding your breath at all. That creates about 6 breaths per minute, which research suggests is a calming rhythm for the heart and blood vessels. This pattern is especially helpful in situations where people feel nervous or tense, like sitting in a waiting room, riding in traffic, or winding down in the evening. Again, place one hand on your belly if that feels comfortable. We'll breathe in and out through the nose if possible. Let's begin. Breathe in. 1, 2, 3, 4, 5. Breathe out. 1, 2, 3, 4, 5. Inhale. 1, 2, 3, 4, 5. Exhale. 1, 2, 3, 4, 5. Keep going at this gentle pace. In. 1, 2, 3, 4, 5. Out. 1, 2, 3, 4, 5. In. 1, 2, 3, 4, 5. Out. 1, 1, 1, 1, 1. And one more. In. 1, 1, 1. What? Good. This kind of breathing helps the heart and nervous system move into a more balanced rhythm. Many people use it for 5 to 10 minutes in the morning and again in the evening. It can also be used quietly anytime you feel tense. No one around you even has to know you are doing it. Now let's talk about the third technique, which some people like to use when they feel a sudden spike of stress or nervousness. This one comes from traditional breathing practices and is often called alternate nostril breathing. It may look a little unusual at first, but many people find it very calming once they get used to it. I'll guide you step by step. Now let's go through the third breathing technique, which many people like to use when they feel sudden tension, nervousness, or a strong stress response in the body. This technique uses gentle, slow breathing through one nostril at a time. It may feel unfamiliar at first, but it's very simple once you try it. You'll use your right hand. Your thumb will gently close the right nostril. Your ring finger will gently close the left nostril. Your index and middle fingers can rest on your forehead or stay folded down, whatever feels comfortable. Again, sit comfortably and let your shoulders relax. We'll start by breathing in through the left nostril. Close your right nostril with your thumb. Breathe in through your left nostril. 1, 2, 3, 4. Now gently close your left nostril with your ring finger and release your thumb. Breathe out through your right nostril. 1, 2, 3, 4. Now breathe in through your right nostril. 1, 2, 3, 4. Close your right nostril again and release your ring finger. Breathe out through your left nostril. 1, 2, 3, 4. That is one full round. Let's do a few more together. Close the right nostril. Breathe in through the left. 1, 2, 3, 4. Switch. Breathe out through the right. 1, 2, 3, 4. In through the right. 1, 2, 3, 4. Switch. Out through the left. 1, 2, 3, 4. Again. In through the left. 1, 2, 3, 4. Out through the right. 1, 2, 3, 4. In through the right. 1, 2, 3, 4. Out through the left. 1, 2, 3, 4. Good. Many people notice that their breathing becomes slower and steadier, and that their body feels more settled after just a few rounds. This technique can be especially helpful when you feel a sudden wave of tension, when your thoughts are racing, or when you want to calm your body before checking your blood pressure. Now let's talk about how to use these 3 techniques in a simple and realistic way. The first technique, the 4-7-8 breathing, is helpful for general relaxation and for training your nervous system to calm down more easily. A simple routine is to practice it for about 2 minutes, 4 times per day. Morning, midday, late afternoon, and before sleep. The second technique, the steady 5-5 breathing, works well as a daily maintenance practice. Many people like to use it for 5 to 10 minutes in the morning and again in the evening. Over time, this helps the body stay in a calmer rhythm throughout the day. The third technique, the alternate nostril breathing, can be used when you feel sudden stress, tension, or restlessness and want to settle your body more quickly. This one is often used for a few minutes at a time as needed. Some people choose to use all 3. Others start with just 1 or 2 and build from there. The most important part is not doing everything perfectly. It's simply practicing regularly enough that your body begins to recognize these calmer breathing patterns. Now let's talk about what many people notice when they practice consistently. Some people notice that their heart rate feels steadier. Others notice they feel less tense during stressful moments. Some notice that their blood pressure readings look more stable over time. This does not happen overnight, and results vary from person to person, but many people find that their body responds positively when they give it repeated signals to relax. Here's a simple way to begin. First, take a blood pressure reading at a calm time of day and write it down. This gives you a baseline. Then practice one of the breathing techniques for about 5 minutes. After that, you can check your pressure again and compare the numbers. Some people notice small changes right away, while others see changes gradually over days or weeks. Next, choose a routine that feels realistic for you. It could be 5 minutes in the morning and 5 minutes in the evening, or short sessions spread throughout the day. The key is that it fits into your normal life, not that it becomes another stressful task. If you already take medications or follow guidance from your healthcare provider, these breathing techniques can be used alongside that routine. They are meant to support your body, not replace any existing care. If at any time you feel uncomfortable, lightheaded, or short of breath, simply return to your normal breathing and slow down. Gentle and comfortable breathing is always the goal. In the final part, I'll summarize how to combine these techniques into a simple daily plan and share what many people find helpful when they try to make this a long-term habit. Now let's bring everything together into a simple, practical plan that you can use in daily life. You do not need long sessions or complicated routines. Just a few minutes of calm breathing, repeated regularly, can help your body stay in a more balanced state. Here is one gentle way to structure your day. In the morning, before starting your normal activities, use the steady 5-second breathing for 5 minutes. This helps set a calm rhythm for the day. Later in the day, when you have a quiet moment, you can use the 4-7-8 breathing for 2 minutes. This supports relaxation and helps release built-up tension. In the evening before bed, use the steady breathing again for 5 minutes. Many people find this helps them settle into rest more comfortably. And anytime you feel sudden stress or restlessness, you can use the alternate nostril breathing for a few minutes until your body feels steadier again. That is all you need to start. What matters most is not doing everything perfectly, but giving your body regular chances to slow down and reset. Some people like to keep a small notebook or use their phone to write down how they feel before and after breathing. Not just numbers, but also how calm they feel, how steady their breathing is, and how their body responds over time. This can help you notice patterns and see gradual improvements that are easy to miss day to day. It is also important to remember that breathing is just one part of supporting your overall well-being. Gentle movement, regular meals, staying hydrated, and getting enough rest all work together with breathing to help the body function more smoothly. No single habit works alone. But small habits, practiced consistently, can support noticeable changes over time. If you already monitor your blood pressure at home, you may want to check it at the same times each day after sitting calmly for a few minutes. This gives more consistent readings and helps you see trends rather than focusing on single numbers. If you ever have concerns about your readings or how you feel, it's always appropriate to discuss them with your healthcare provider. These breathing techniques are tools you control and can use anytime, but they work best as part of an overall plan that fits your personal situation. Many people feel encouraged when they realize that calming their body does not always require something complicated. Your breathing is always with you. You do not need special equipment or perfect conditions. Just a few quiet minutes can support your body's natural ability to settle and recover. If you found these techniques helpful, you may want to practice them for the next few weeks and notice how your body responds. Small changes in how you breathe can influence how your whole body feels. And if you know someone who feels tense easily or worries about their blood pressure, sharing these techniques may help them too. On this channel, we focus on calm, practical habits that support feeling steady, active, and confident as the years go by. We'll continue exploring simple ways to support circulation, movement, and everyday comfort. Thank you for taking these few minutes to breathe with me today. Take care of yourself, move at your own pace, and I'll see you again in the next video.